So thank you very much for the introduction, Mervyn. And I'm delighted to be sharing these findings from our latest study, which was funded by the HSE R&D division. It's an enabling award, so it allowed us to participate and develop new knowledge in an area that we had identified as there was little knowledge in. So for the slideshow, I'm just going to start the slideshow. This is the wee bit that I was saying to you before that can be tricky. There's a little black box that hangs down. It just kind of stops you from hitting the slide. Let me see. Hide quick access toolbar, would that do it? Hold on. There, from beginning. Here we go. Apologies about that. Probably something I was doing wrong. Okay, so we're presenting today on behalf of a team of us on the study, the moral and the fiscal costs of social worker turnover and child protection social work. My name is Paula McFadden. I work at Ulster University, and with me today is Gillian Martin, who's a senior economist, also working at Ulster University. And you can see the names of the other people that were involved in the study with us here on the screen. So this is a three-dimensional study. We have, first of all, that economic analysis, which Gillian is going to share with you after I have gone over the qualitative section of the study. We also have accessed data via the Honest Broker Service on administration in relation to children's services in a couple of the trusts over a couple of years here regionally. And that is to look for any statistical association between turnover in social workers and outcomes for children, including areas of multiple deprivation analysis as well. The bit that I'm going to present now on is about the qualitative aspect of the study, whereby we have asked those that have been recipients of child protection services about, any impact of social worker turnover has had on the experience that they have, that they have lived through. So the third bit is assessing the impact of social worker instability and child protection social work from a service user perspective. So I'm going to just start with that and a bit of context. So why is this important, right? We know that historically and, recently, there has been a growing issue about turnover and vacancies, particularly in children's social work. That we know that there's lots of work going on regionally and nationally and internationally trying to both understand it and to try and retain staff. So that is the kind of context that we're coming from. But this presentation centres on the voices of the service users themselves. We spoke with care leavers, parents, foster carers and advocates organisations about how instability in social work and turnover in social work affects the service itself and the individuals who require the service. The main objective, I suppose, is about, we have to think about turnover not just as a staffing or a workforce issue. It's a critical factor in child protection outcomes. And it's also a critical factor because, people whose voices are rarely heard, we don't get to hear what those outcomes are for them. So we decided to look at this because in all our research about workforce and our justification for doing that, we are always citing research that is probably about 20 years old and comes from America about, the impact on children's services because of turnover. And so we decided we must address this gap locally and nationally. So part of that, we did a literature review. And I'm going to talk to you about some of the main findings of that in a minute. and then I'm going to talk to you about what the themes were that emerged from our work with service recipients. So why does turnover matter? It's relational loss. It's not just about, that organizational churn, but of course it's about that as well. There's a loss of relationship. So that means that, the trust and the rapport that's built up with a social worker, if it's disrupted and frequently turns over, families begin to withdraw their trust. And that can affect, the engagement with services and the engagement with, particularly between those that really need the service and the social workers themselves. And it can leave families feeling deeply vulnerable. The impact of repeated changes on children can destabilise and disrupt sometimes the placements and can delay permanency. So we've had many examples of this that I'll share with you as we move through. And that relational cost can, and loss can compound trauma already experienced and reduce engagement with the system. So all of that is highly problematic, as you would imagine. So whenever we went to do this literature review, we had to go back to the 80s to find relevant literature. There's such a lack of writing on this, such a lack of research. And that's what I mean about the people's voice, being unheard. We had to go back to the 80s and we went international. We only have found 11 studies right over that period of time, and 2 of them were reports that came from England in more recent times. But the rest were peer-reviewed studies, and basically what they were telling us was identified in 4 different domains, if you want. So the first one was about relationship disruption and trust erosion. The second one was about permanency and placement and stability. The third one was about emotional and psychological impacts. And the fourth one was organizational and structural mediators. So things that might help social workers stay and, therefore prolong the relationship between social workers and the service users, were things like workload, supervision, and good team working. So the first domain there, relationship disruption and trust erosion. So what we found was the frequent changes in social workers was undermining the development of consistent and trusting relationships between children, families, and the social workers. And turnover, we found, fundamentally disrupts relational continuity. And the findings also, highlighted the importance of recognising the turnover isn't just an operational issue or an organisational issue, but it can have, profound impact, disruptions, and emotional and sometimes developmental consequences for children in care. Domain 2, about permanency and placement stability. Turnover contributes to delays in achieving stable care arrangements for children and adolescents. So basically, that turnover, what people were telling us was that, because, there was like disruptions, there was maybe periods without a social worker, that things weren't happening quickly or having to retell stories. And I'll come to that again as the slides move forward. Many children in the care system, they continue to experience unacceptable levels of disruption and instability in their lives. And that compounds earlier instability that they've experienced in their own family lives as well. Instability not only delays permanency planning, but can also have lasting consequences on all that trust and relationship, and can also impact educational attainment. And that's some of the feedback that we've had from care leavers about their impact as well. So the third domain was about the emotional and psychological impacts, and that is about distress, confusion, sense of loss, Sense of abandonment as well. People talked about that they can experience due to, not having the same social worker, or, having repeated social workers in their lives. Care experienced young people frequently reported feelings of abandonment and grief. And we were hearing that not just through the literature, but also through the interviews that we had with the children, with the young people. And then, they felt that they had to rebuild new relationships and then maybe lose them again as well. So domain 4, organisational and structural mediators. So what we were finding under this domain was that things like systemic factors such as caseload pressures, workload pressures, having supportive supervision and a team composition, good team support and camaraderie can influence the effects of turnover on service delivery. So stronger teams that were able to, pull together and maybe cover for absent colleagues or join the dots, understanding the background to the case instead of families having to start from the beginning, seemed to be one of the things that, could have improved the outcomes. Findings reinforced, though, the importance of addressing not only the instability, but the broader organisational context in which social workers operate. So having, retention at the fore, in terms of well-being of social workers and the structures around them that support them, like good supervision, like, a workload that's within capacity and so forth, were all really important, came out in the literature here as well. So collectively, the study suggests that turnover can't be understood just in isolation from wider organisational and systemic conditions, but also needs to be understood, in terms of the relational impact and all of the impacts that I've just described. So how does social worker turnover affect the quality of service received by children and families? So I'll tell you a little bit about that. So just give you, a reminder of the policy context, and we have had in 2022 the workforce review here that proposed strategies to improve the supply, recruitment, retention of social workers. And, that work, that implementation work continues and is, importantly addressing some of the issues that the literature has found. And then you've got the retention as one of the 6 strategic themes, right, that has emerged from that. And then 2B recommendation was about the safe staffing workloads. So we have some good positive work going on regionally here. So I suppose I present what we're presenting in the context of this background where, there's a lot of work going on to try and improve retention and social work. So the current study is important, as I've already said, about the underexplored dimensions of workforce and stability in children's social work and how it impacts on children and families. And so this is really important because, it underscores, again, there's a moral reason why it's not just, obviously the cost, the well-being, the social workers, the organisational impact, but it's so important that the service that we invest in, as a society, is one that actually reaches and impacts on the lives of those that need it most. So we seek to address the gap that we have found by exploring what these relational and moral costs are, in particular with the disrupted relationships and lack of trust that can evolve from that, that reduces the continuity of care. So we've 18 themes. We've done thematic analysis, right, across interviews and focus groups. The interviews were with care leavers, foster carers, and with parents themselves with lived experience. So there was 18 interviews in total. these were one-to-one interviews, right? And were all recorded and transcribed and then analysed for themes. There was 3 focus groups, one with VOIPIC, one with Praxis Care, and one with PassNet, who are an organiser, like a grassroots organisation, looking at advocacy services for parents who are known to children's services. So we explored all the perspectives from all these different angles, and we were able to identify really 6 key themes. And we've called this the CARES framework, with each letter being, this being an acronym for the main things that are about the impact of turnover in children's services. So stable relationships at the core, stable and consistent relationships, consistent communication are the essence of care. That's the core message. So the 6 areas are consistency, access and fairness, relationships and trust, endings, records and communication, and safety and thresholds being met, right? So I'm just going to say a little bit more about these 6 domains here. Consistency is about that stable relationships, building trust and improving outcomes. So this is what we found from the analysis of the qualitative data that was shared with us. Access and fairness, workforce instability leads to unpredictable access to support, resources and opportunities. So, for some people, they were saying, there were occasions whenever, maybe they knew somebody else that had a social worker and it was consistent and things were happening faster, and that they didn't, and they felt they were abandoned. Relationships and trust, so frequent changes erodes engagement and can re-traumatize children and families. Endings and abandonment, when social workers left without warning, no ending, no handover, participants were left with confusion, uncertainty and emotional pain. Records and communication, participants described missing files, inaccurate information, sometimes, very important, like case conference reports and so forth, and confusion or inconsistent communication. And they felt that was because, the frequency of handover or of no handover, the frequency of turnover, and, they didn't always feel that social workers had completely read their file. They were coming out from scratch, asking people to repeat their stories from the beginning. And some people were just saying, that they had a hostile relationship then with social workers and that it did erode their trust. Safety and thresholds, so turnover and chronic staff shortages were affecting staff and risk management within children's services. So, some people talked about that kind of feeling of being in crisis, not really feeling that they were supported, and feeling that there was risks as a result of not having a consistent social worker. So just to say a little bit more about consistency, right? So the revolving door, having to repeat stories, like I just said, frequency of changes left people feeling invisible and mistrustful, transformative stability. Participants that had consistent social work talked about it being transformative, that it changed their lives, that it led to better outcomes for them and their families. Smoother planning, predictability, and a strong sense of being supported and heard. So it wasn't all negative. We did get some feedback. It wasn't the majority of feedback, but it was some feedback that when it's good, it's excellent. Team level consistency, shared practice values can buffer against individual turnover. So that is like whenever colleagues would know a case and, not have to go out and start a story from scratch all over again, or, was already familiar with the family and so forth. So there was trust in a team that was stable as well. CARES, theme 2, access and fairness. So as inconsistent decisions, support varied between who answered the phone. Sometimes they were talking about how intake was taking the all the calls and passing on, and sometimes there was misinformation or information not wholly accurate. Missed reviews on allocated cases stall progress, and sometimes reviews are missed, and therefore an access to rights and responsibilities of social work whenever a child is known to social services. Staff filling gaps. Advocates take on roles meant for statutory teams. So sometimes the likes of, say, for example, Voipic with their key worker roles, they felt that they were taking on roles that's usually meant for the statutory teams because there was an incident or there was some occasion where something needed to be done. So there was like a blurring sometimes of responsibilities, roles, and so forth. The third one, relationship and trust building, which is the foundation of support. Retelling stories, we've talked about that. Judged or heard, sometimes the change in social worker meant a completely different perception of the situation the person was in. Transformational bonds, long-term workers that didn't turn over, often credited with life-changing outcomes. Endings and abandonment. So abrupt exits, so without any handover. This came through in the interviews as well. No handover, sometimes not even knowing the social worker had left. So people felt like they were falling through the cracks. They felt abandoned. There was unallocated periods, meaning missed care and oversight. And there was a learned hopelessness coming through. Young people stopped asking for help, expecting not to get it. And finally, the records and communication, misinformation, inaccurate files leading to damaging or court or care decisions, communication blackouts, young people unaware of changes and feeling abandoned, and fixable failures. Simple steps like joint handovers could prevent some of the harm we're describing here. And the final one is the S again, safety and thresholds. So rising thresholds, so fewer workers meant delays or denied intervention, and maybe the use of duty intake rather than having a named social worker. People were telling us about how frustrating they felt that was. Displaced risk, carers and advocates asked to manage risk beyond their role. Crisis support culture, often triggered support. This type of support only is often triggered after harm occurs. So they felt like there wasn't a lot of prevention work happening early. Life story work. So children's narratives or life story work were often incomplete, especially if reviews had kept being put off. Whenever workers changed, it was put on to the next review meeting and the next review meeting, and files were sometimes not available, and the process was stalled. So that is the qualitative part and the literature that we've found. We found that the literature and our own findings, we found that the literature and our own findings definitely like echoed it out. And even though that's come back to the 80s, the literature that we write now, so that in itself tells us a lot, that this is kind of good evidence now about raising the voice of the people that require the service, and therefore it's that moral aspect of the study that I have just covered for you there. Gillian Martin now is a senior economist in the Economic Policy Centre at Ulster University, and Gillian has produced an estimation of the fiscal costs of social worker turnover in Northern Ireland using publicly available data and seeking out clarification from the likes of the Social Care Council, just to sense check some of the numbers. So I'm going to hand you over now to my colleague, Gillian. Gillian, I'll move the slides on for you. You just tell me when.
That's great. Thanks, Paula. Hi, everyone. Yes, I'm Gillian. I'm an economist at the Economic Policy Centre. So my role was looking at the data to try and put a monetary figure on the cost of social worker turnover in Northern Ireland. So if you just move on to the next slide, Paula. So to do this, we used this formula or calculation that we sourced from an article by Altman to try and estimate how much employee turnover really costs. So we needed to gather a variety of data on the number of lost employees and costs. So the lost employees meant gathering information on headcount of social workers and the turnover of them within the last year. In terms of the cost, sorry, just go back, Paula. In terms of the cost of social worker, we needed a variety of information on the cost of hiring, training and onboarding, learning and development, and then the lost productivity of the role being unfilled. Next slide. So to do this, there's a variety of sources of information on data on social workers. So firstly looked at information that's available at a UK and Northern Ireland level. So the information from the Office of National Statistics on workforce jobs, the likes of the Quarterly Employment Survey from NISRA in Northern Ireland to give us the two-digit level information on what makes up the health and social work sector here in Northern Ireland. So human health activities, residential care and social work without accommodation. There's also the likes of information on occupation data in the Business Register and Employment Survey, as well as the Annual Population Survey. And then we use the annual census from the Northern Ireland Health and Social Care Workforce Census, as well as data from the Social Care Council itself. And just next slide, Paula. So firstly, we thought it was important to outline how important the health and social care sector is to Northern Ireland. So the chart here shows the total workforce total workforce jobs by sector in Northern Ireland in 2024. So that's the latest full year of data. And as we can see, the health and social work sector is the largest sector in terms of jobs within our economy, and it represented 16% of all jobs here in Northern Ireland, and it has grown by over 50,000 since 2000. So the role of that sector can't be downplayed here. Next slide, Paul. So whenever we break down what makes up the health and social care sector, it includes human health activities, residential care and social work without accommodation. And that social work part, occupation, has roughly made up around 25% of jobs from 2024 or 2014. And it has increased, the social work activities has increased by over 4,700 since 2014. So it has grown over the last decade. Next slide, Paula. However, whenever we looked then at the annual population survey, so this chart shows us the change in social workers across the UK. So the annual population survey reported that there were 4,400 social workers in Northern Ireland in 2024, but this was actually a reduction of 1,200 from 2023, and the chart shows the reduction or the change in social workers from 2021 to 2024. So we can see that apart from Scotland, the rest of the UK has also experienced a decline in social workers, and Northern Ireland has experienced the largest of around 2,000 social workers in a 3-year period. So although from that first chart I showed on the workforce jobs, that social work, the health and social work sector overall is such a vital sector to our economy, there has been a reduction in social workers in Northern Ireland as well as the rest of the UK, excluding Scotland. And next slide. Yeah, if you just move on, Paula. So, sorry, is that the next? Yeah, so looking at then the number of social workers registered within the Northern Ireland Social Care Council, there as of February 2026, there are 6,904 social workers. There are over 49,000 social work registrants, but we're specifically focusing on the social workers. And this was a 2% increase on the February 2025 figure. Next slide, Paul. We then looked at the health and social work workforce census. So it shows that within our trusts here in Northern Ireland, there are 75,000 health and social care workers in 2025. And within this, 9,730 were in social services, and then further down of 4,910 were social workers. The chart here breaks it down by type of social worker, and we can see that child and family care social workers were the largest social workers by type in Northern Ireland. And it's those child and family care social workers that our study was focusing on. So we were focusing on the child and family care social workers at band 5 and 6. Next slide, Paula. To help us understand the need for social workers and whether, in terms of workforce planning, whether there's enough social workers, we also calculated the number of social workers per 10,000. And we did this, 10,000 people in Northern Ireland, and we did this across all of the different sources of data to convey that whenever you get down to the actual people who are on the ground working, is there enough social workers? So when we look at that first bar, which shows the health and social workforce from the workforce jobs. So that very first chart I showed of just back, Paula, sorry.
Sorry.
That very first chart I showed of that health and social work is our largest sector. When we break it down, sorry, Paula, if you can just put the slide back.
Gillian, I'm sorry.
You're
This
okay.
seems to be doing something. It keeps moving on without me moving it.
Automatically, sorry.
Apologies.
You're
Apologies.
okay. So that first bar shows that in terms of the health and social work sector as a whole, there is 786 jobs per 10,000 people in Northern Ireland. And when we break that down across all of our sources, and by the time we get down to the health and social care workforce census, and for the child and family care social workers, there's only 11 child and family care social workers per 10,000 people in Northern Ireland. So although we know that the health and social work sector is such a vital sector, not only to our economy, but to the people here, whenever we break it down by the types of social workers and just social workers alone, we can see that there's actually potentially very few social workers per 10,000 people, and figures like that could be used in workforce planning to help address whether there are enough social workers to meet the needs of people, and as well as not just to meet the needs, but in terms of a caseload perspective for the social workers themselves. And next slide, Paula. Hopefully it stays. Um, so again, just for a wider context perspective, we put in some figures on the growing demand for social workers in terms of our changing demographics here in Northern Ireland. So in Northern Ireland, we do have a ageing and growing population. And the chart on the right in particular shows that our population is ageing. So there could be a shift in the demand for social workers, maybe, well, it depends on different circumstances, but maybe more older people, social workers needed. And it's also important to note that as our population ages and grows, so too is our workforce. So that needs to be factored in to our workforce planning, not only in the health and social care sector, but the wider economy as well. And next slide, Paula. So in terms of getting into the turnover rates, so look, the Department of Health in the Workforce Census do publish the number of leavers and the leaving rate. So for the overall staff turnover leaving rate, it was 7% in the latest data 2024-25, and that was over 5,200 social workers who left out of the 74,000 workforce. Next slide, please, Paula. Whenever we broke the turnover rate down by staff group, so registered nursing and midwifery had the highest number of leavers. The bar circled is social services, so that's not just social workers, but all social care staff. They had just over 620 leavers in 2024-25. That was a slight drop from 80 in the previous, or 80 fewer than the previous year, and it made up a leaving rate of 6.6%. So it was the third highest leaving rate across the staff groups. And whenever we applied that leaving rate to just child and family social care workers, it suggested that over 140 staff left their role during this period, during the 2024-25 period, and that's down from 165 in the 23-24 period. Next slide, Paul. So to get the monetary figures, we also needed to gather data on some other aspects. So the cost of hiring, training and onboarding, learning and development, and the opportunity cost of the unfilled role. Now, this involved some mainly just desk-based online research to find the best sources of data for this information. So the cost of hiring, we went with in the end, the median cost of hiring in the public sector at £1,000 from the CIPD. The training and onboarding was from the Skills for Care, Recruiting for Values, valued at 2,200. And then the learning and development. So we went, after discussions with staff from NISCC, we went with just focusing on Band 5, 6 social workers, and that annual year on practice with an estimated cost of 1,295, and then the PIP cost, the university fees taken an average from Queen's and Ulster at over 3,700. Then the opportunity cost. So we use productivity as for this. So the productivity of the role being unfulfilled was over 41,500, and that was gained from the Economic Policy Centre's Northern Ireland economic model. Yes, next slide, Paula. So we put all of these figures into our calculator. So just for child and family care, social workers at that Band 5, Band 6, it is estimated that the turnover in the most recent period had a cost of over 7.1 million. And if you go on to the next slide, Paula. So the picture on the left is what it looks like in the Excel. So when we put all those figures into our Excel, it gives us that cost of over 7.1 million. And it suggests that if it was even reduced by 20%, it could save the trusts 1.4 million. So there are significant figures here being discussed. And that could that money, 20% saving, could be used to employ 42 Band 5 or 6 social workers. And next slide, Paula, please. We then did the same calculation again but for all social workers, so over 4,900 social workers that were employed by the trusts in 2024-25, and based on a turnover of 6.6%, so that's 324 people leaving, it had a cost of 14.7 million. So that is a significant cost for the 324 people million. And again, if that was reduced by even 20%, it could save nearly 3 million a year. Next slide, Paula. So this table here breaks down the estimating the cost of social worker turnover across all of the different types of social workers. Now for this one here, we did do this for all bands, so it's not just the 5 and 6 that we focused on for our study. So the learning and onboarding costs were adjusted to just be that 30 hours of annual training a year. So that was just to show a breakdown, and because child and family care social workers do have the largest number of social workers, it will have the highest estimated turnover cost. So if we just excluded the child and family care, the turnover at 6.6% could have a cost of 8.2 million to the trusts. So this is just focusing on the trusts alone as well. Our study, it doesn't focus on social workers who are employed outside of the trusts in Northern Ireland. And next slide, Paula. So that was just a quick overview of those monetary costs and how we conducted the study using the variety of data available to us. I would suggest that these, although those are significant figures that we have included, I would suggest that they are conservative based on the information that we could find. It doesn't include all of those factors that Paula addressed at the start, the well-being impacts, the knock-on effects on waiting lists, the likes of admission costs to university and placement of student social workers. So there is a lot more that is worthy of being factored in there, but it's just finding the data and monetizing it as well to put it in there. So overall, hopefully these figures have helped to show that turnover isn't just a workforce issue, but it also has a material fiscal pressure on the public sector. And that's particularly important at a time when we know different departments are struggling with budgets, and I would suggest it will become more important as time goes on. So thank you, and I'll hand back over to Paula.
Okay, so thank you, Gillian, for that, and apologies. The slides had a life of their own, so
You're all
I was
right.
trying to go back whenever they were. So apologies to you and to everybody watching. Yeah, so the cumulative impact of turnover. So we're talking about, the moral and the fiscal. For the moral, it is that, the loss of trust and the potential of improved outcomes for children and families. So service users and staff both are describing, they're talking about, their well-being impacted from systemic failures, and service users are saying their lives are negatively impacted as well. Disengagement, that could mean that we put people back many steps if they disengage, with any potential of better outcomes for them and their lives. So the wider consequences can be placement breakdown, educational disruption if the child has to move from one area to another, and trauma reoccurrence. So we're not saying that social worker turnover is the only factor in some of these outcomes for children, but from the voice, the perspective of the children and the families that we spoke to, there seemed to be like a very much the same kind of themes coming from them all, and that included talking to organisations about their advocacy role as well for families and children. So we seem to be getting the same messages. Policy implications. So we're talking about the reduction of turnover being a safeguarding imperative. Relationship-based practice being, at the core of everything we do in social work. And the support for models that prioritise that continuity and trust with individuals and teams. Organisational changes, things like, we've got the policy and legislation coming on safe staffing with workload standards, also being part of that. So that, if we're able to achieve, improvement in workloads, will only improve the well-being of staff. Better supervision, consistent supervision, we have a policy on that as well. And the research suggests that, relationships with a good manager, good, positive, consistent supervision can, help people to want to stay in the profession, and have trauma-informed workplaces. And I think we're all very familiar with the trauma-informed literature and why it is important. Service user recommendations, planned endings. Every ending should be communicated and supported. Proper handovers, that should be a priority. And I know whenever teams are under pressure, that might sound, like something that is not very realistic. But if we can just see, how that type of ending impacts and compounds potentially earlier losses and feelings of abandonment, I think it is an important one that we have to revisit. Stable teams, team continuity can absolutely buffer individual turnover. Relationships at work are key. Relationships between team members and relationships with managers and the wider organisation. And those relationships, can be nurtured and developed to retain staff. Being heard, ensuring service users voices are elevated and that they're heard, and that those voices will help to shape the changes or any reforms, and not just survive services. Some young people did talk about just it was another thing to survive. The repeated losses of social workers. So why does it matter now? So there have been rising caseloads, high vacancy rates, and staff burnout that's well recorded in the research. For children and families, disruption is often the norm and not the exception. And there's a moral imperative. Service continuity is a right and not a privilege. And it's something that we have to revisit in terms of, that getting relationships consistent. So workforce instability can compound child protection issues. We're seeing that in the literature. We're hearing it from the interviews and focus groups and from those that are the advocates for children and families. So turnover isn't just an operational issue, although it is that as well. It impacts trust and the safety and the feelings of safety and the outcomes. It's not inevitable, so improving culture, better retention policies, ensuring that well-being of social work is put at the fore, because indirectly then you're improving the service that the people that need it eventually then get. So it's like a trickle down, if we have the workforce stable and people working optimally, then that the people that are receiving the service are going to get a more consistent service, and that the caseloads, the safe staffing standards that are coming out, hopefully will be an improvement and provide the kind of framework for people to be able to discuss and consider safe workloads. And that all taken together can support people and reduce harm. So it's not a separate issue. Service user and practitioner wellbeing are actually very closely interconnected, and that is something I think that we need to join up. So next steps, dissemination. That's what we're doing now. We're taking the results out to everybody that is relevant to hear about them. And today is one of those steps. Co-production. So we have involved, obviously the service users in the study, but we had a couple of service users as well on our advisory group. So that was really, really valuable as well to sense check, different findings and perspectives as well. Long-term vision, stability and trust embedded as core practice values. Safe and effective staffing policy and legislation and workload standards, implemented in legislation and policy. And the wellbeing framework, there's the Department of Health Wellbeing Framework, Strengthening Our Core, has pillars for wellbeing for staff. There's a focus on wellbeing and retention as a regional approach across the health and social care systems. human resources and organisational development engagement, and we're involved in that as well. And so that's another important kind of foundation, you know, for organisations in terms of wellbeing. So that's just some references. And thank you very much. We really appreciate everybody's time. Happy to take a few questions. And that's just a note of thanks also to all of those that participated in this research. Their voices were invaluable. We hadn't heard them before here. So the care leavers, parents, foster carers, and the advocacy groups. And a thanks finally to our funder, who is the Health and Social Care Research and Development Division. And that's just a reference to the fund reference number there. So thank you very much.